Yeah, a very good morning to everybody. Today, like almost, we have completed 1 month of the COVID pandemic lockdown in India. Yes, the graph is rising, but it is not an exponential rise. It is a linear rise. Yes, deaths are there, but relatively better than any of the other developed countries. But still, it's a long way to go, and we should not break the chain. The community spread has to be stopped if we want to curve to be flattened. So, as an individual in a healthcare system, we do have certain do's and don'ts, and the patients are really suffering, particularly maybe in all branches of medicine and all the more in cancer patients. And so they cannot come to the hospital, they are halfway in their treatment, some have complications, some are emergencies, some are waiting for radiation, some are waiting for surgery. So yes, we need to do something. Yes, with the advancement of technology, we do have with us what is called a telemedicine, that is by which the doctor are registered. It has to be a registered medical practitioner who is registered with the Medical Council of India in any state, can do a telemedicine consultation. It can be a text, it can be audio, it can be video. So let me tell you what are the videos. The videos which we can do a Skype, you can do Zoom, you can do FaceTime, you can do direct video calling. All this is possible. And if it's an audio, it can be using a phone call, usually internet-based phone call. You can use WAN. These are the audio calls, and internet calls, WhatsApp calls are allowed. Next is text, a simple SMS. Next is messenger. We can all use. These are some of the modes of telecommunication, or digital mode of communication, where the doctor and the patient is at two remote places, and we are trying to get connected with the digital mode to deliver what we can do. Even you can use Google Hangout and Facebook, WhatsApp, Facebook Messenger, Skype for consultation. So that's how a digital environment looks like, and I'm sure most of our people, and if not at least one family member, will have an Android phone where you can easily download. Most of these apps are free and it's all internet based, and if you have, so you can continue consultation. Some of the prerequisites of this telemedicine is that very important. First point is that the person who is doing the telemedicine has to be a registered medical practitioner with the Medical Council of India. Nobody else can do it. Any other healthcare worker can facilitate it, but he or she should not be the primary consultant in this. Secondly, we need a consent. The consent is in the form of whenever a patient just calls to do a telemedicine, that itself is a consent form. Otherwise, a formal consent has to be taken for the patient. Privacy is very important. So now we are seeing many of the apps. Some of the apps are not very safe. Some of the apps are quite safe, where you can go, because we need to maintain the confidentiality of the patient's data and what we talk. So consent becomes an issue, misconduct becomes an issue. So these are the first three important points. Next is, what are the things that you can do in consultation? Is that it can be three types of patient. First is a new patient whom you have not consulted. Yes, that's a little dangerous if you don't know and not seen with telemedicine, but it may be your own patient whom you have consulted maybe 6 months back. That is also a little difficult. It also becomes a new patient for you, or another patient of yours whom you have consulted for another disease, but not for the present disease. So a new consultation beyond 6 months, and a consultation of the same patient with a new disease, these three are little difficult, and it's taken as a new consultation in telemedicine. Next is, you can do follow. What are the things that you can do in telemedicine? And I'll tell you what are the things you can't do in telemedicine. One of them is that you cannot do emergency consultation in a telemedicine. Suppose there is like heavy bleeding, there is a fracture, there is perforation, there is stroke, there is a cardiac arrest. Yes, if somebody calls you in telemedicine, we need to guide them to the nearest medical hospital or the doctor, because this cannot be handled by telemedicine. Very clear. Other telemedicine consultations are that suppose a patient is on follow-up, cannot come, he wants like diabetes, hypertension, even in cancer, maintenance, oral drugs, okay, that can be given consultation over the follow-up. Once you finish the video and the audio consultation, you can tell them to follow the same prescription for maybe another month or so and review back once the lockdown is over. Some patients has some few smaller complaints which can be also sorted out. A prescription can be given, okay, that can be found out. But remember, never, you cannot do an emergency consultation over telemedicine. You cannot consult and guide anybody for any surgical procedure or endoscopy or robotic surgery. You cannot do research over telemedicine. So these are some of the guidelines that one needs to follow. So do not do any guide over a surgical procedure, invasive procedure, endoscopy, robotic surgery, any research and any emergencies. These 5 points cannot be done in telemedicine. But points like some small problems can be sorted out, some new appearance of lesion or appearance of symptoms, okay, follow up, continue the drugs and review with the reports. We can also upload the blood test report, the scan reports, the x-rays, the ultrasound, the ECG and you can have a visual and give your opinion. So this type of consultation is can be done in this digital things. Now let me see what are the advantages. Now if you are seeing for the text, particularly messenger, SMS, so even WhatsApp messaging, it's fast, it doesn't need much internet connection, you can communicate easily, keep chatting, you can, and in WhatsApp they can, so these type of text messages are faster, not dependent upon internet, and you can easily solve the problem. But the advantage is that you cannot see the report. Whereas once you get into the WhatsApp, you get into the other video calls, Google Hangout, Skype, Zoom, then you get to see the patient, okay, then you get to see the scans, you get to see the reports, and after it's just an inspection because you cannot touch the patient. So you can give your opinion based on the inspection finding, and if it is something new lesion, new tumor, further investigations, you can order and tell them to review back with them. There is also audio. Audio call is also faster, immediately, unlimited. You can directly talk to the patient and you can give your opinion, but you cannot see any of the reports. So each of this, so this audio, video and text, these 3 forms of digital communication or digital technology has its own advantages and disadvantages. We do use all of them in different ways together to give a teleconsultation, because this is sometimes of prior importance in COVID pandemic, where it's lockdown and we have not faced, we do telemedicine for a long time, but now there are guidelines, there are rules and regulation, privacy has to be maintained, consent has to be done, it should be a registered medical practitioner, and always remember, take consultation fees, okay, and if possible the telemedicine can be documented. Avoid emergency consultation, avoid surgical details, robotic surgery, and there you need to send the patient to the local doctor for management. Now, let me, before I finish, one more thing I want to add. There are lists of medicine O, A, B. O means some small things you can order over the phone, like antidiarrheals, loperamide, you can give paracetamol, cough syrup, sometimes chills and Riger, Avil. This is O. A is those medicines which is little difficult. You can, but it has a low abuse. Usually I prescribe A medicines after seeing the video or the WhatsApp picture of the patient. B and the other is narcotic. You cannot give narcotics, you cannot give antipsychotic drugs over telemedicine. Yeah, that is a little bit of difficult. Sometimes there are many psychiatric patients who needs just to continue the same, but then that's a debatable thing whether, but from guidelines point of time, antipsychotic narcotics are not to be prescribed at any point of time in a telemedicine. Restricted medicines are there, many of them are your old patients, they are on oral chemo drugs. Yes, you know the patient, you've seen the reports, you have done a consultation, yes, oral chemotherapy drugs can be continued. But any high-risk drugs, it is difficult to restart in teleconsultation. So these are some of the points which I wanted to tell, and I sign off today. Stay safe, stay healthy, stay connected, okay, and we will have to fight this virus all of us together.